sir, representing the Vaidyaratnam group. Okay. So I think that it's high time to discuss some very small topics like that of respiratory infections or fever, rather than going behind autism or cerebral palsy on a platform where we generally discuss diseased conditions in children. And I feel honored, and it's my pleasure to share that I'm highly delighted to be here for this presentation. We'll start the presentation now. May I share the screen just 1 second? Hope my screen is visible to all, isn't it?
Yes, sir, it is visible.
Okay, fine. Thank you, madam. Thank you. So, as ma'am mentioned, we are discussing about the Ayurvedic approaches to respiratory infections in children. I think that the maximum number of cases coming to our OPD nowadays will be of with respiratory issues. Today morning, I got 20 patients with respiratory infection. It was a coincidence. Almost 20 patients were with respiratory issues like that of a cough, dyspnea, or allergic manifestations. This was the common picture which I met today morning. So I felt that whenever I go through the past history, because majority of them come from other consultants as well, some of them may be fresh cases. So when I go through the respective prescriptions, I have seen them taking large number of medicines, including Ayurvedam as well as the modern prescriptions. So I feel that the symptomatic relief given by any sort of medicines is not the correct method in addressing any disease. Even though in casualty management or Atika Chikitsa Vibhagam, definitely we have to work on that dimension. But the basic principle of Chikitsa demands something more than that emergency management, isn't it? And I have seen large number of patients coming with this high dose of steroids, antibiotics, and of course the increased intake of antihistamines like that of the Montelukast, etc. It is very common in our OPD. So I generally believe that we should say no to unwanted medications. The thing is, we should know the area where we have to say the word no. And we should know that where are the areas where a medicine is very much necessary. For this, I will just rush through some of my slides which contain some basic principles of Chikitsa with respect to respiratory illness. And this is just a framework for which, after which we can work on this, and we'll have some discussions at the end of the presentation. So I welcome you all to my presentation. We know about the Rogi Parikshas, isn't it? Darshana Sparshana Prashnehi Pariksheda Roginam. To examine a patient, Acharya himself has mentioned about 3 important methods to assess the condition. For the clinical examination, we have 3 important upadhis or methods to assess the patient. Darshanam, Sparshanam, as well as Prashanam. I think that most of the audience who are here is having a good experience sitting in Kaumaravartim OPD, isn't it? And it is a truth that we can't even do more than 2 examinations in a patient, especially in the case of pediatric age group, because even though we use the term pediatric age group, it is a big compartment starting from a newborn patient up to 16 or 17 years of age until the child attains Dhatu Indriya Ojasam Vriddhi. In that particular age group, if we cater to the lower group, that is, if a child is less than, say, 4 or 5 years of age, it will be difficult for us to get a conclusive data with the help of all these 3 parikshas alone, especially in the case of very young children who comes under the Kshirada or the Kshiranada age group. And in such children, we have to adopt another pariksha, which was told by Acharya, which is nothing but the Stanya Pariksha. And this Stanya Pariksha is not a much tried examination method in assessing the diseased condition of a child nowadays. Many reasons may be behind that. But I feel that this is one of the most easiest method as well as the non-invasive method. We don't need to take blood. We don't need to go for a costly investigation. it is very easy to perform Stanya Pariksha within the 4 frames of our OPD itself, provided we have to respect the privacy of the mother. And I feel that if we could do a Stanya Pariksha in front of the mother, we can give a conclusive data regarding the Patyaharas, regarding the Nidanas, regarding the protocols to be accepted by the parent in addressing the disease beyond the involvement of a clinician. Of course, majority of the cases, sometimes these parikshas will not be enough to assess the child. We should have some clinical experience. We should have some idea from the modern perspective as well. All these things blends together in assessing the condition of the child. Now, coming to Stanya Pariksha, especially in the case of, I used to see mainly this children less than 1.5 to 2 years of age. Mainly, that is the picture which I see in my OPD. And if we could perform this Stanya Pariksha in front of the parent, I feel that that gives an easy path for clinicians like me to form a prescription or to prepare a prescription in which the parents will be with us. Otherwise, we know that nowadays the parents will be having a tendency to go for this doctor purchasing, isn't it? They are ready to pay any amount of money to cure the child without having a sensible understanding about the principles of medical management. So I'll just show you one video regarding how to do Stanya Pariksha. There is no sophisticated mechanisms or instruments that are required for performing a Stanya Pariksha, other than we require one glass tumbler with fresh water, which is transparent. And Bhagbada clearly says that if it is a Shuddha Stanyam, he says that Yad Adbihi Ekatam Yadi. That is, the Shuddha Stanyam is that Stanyam if when instilled or if we pour some quantity of Stanyam in one glass of water, that will form a uniform mixture. Yad Adbihi Ekatam Yadi Nacha Doshehi Adishtidam Tad Vishuddham Paiha. So, Shuddha Stanyam is a Stanyam which is not having any doshic afflictions. At the same time, how can we assess whether it is Shuddham or Ashuddham? That is by instilling a few drops of Stanyam into one glass of fresh water, by which it makes a uniform mixture. Hope that is clear. So, on the other hand, what is Ashuddha Stanyam? Ashuddha Stanyam are all those don't satisfy the previously quoted condition. So now we are going to see an Ashuddha Stanyam. And in Charaka Samhita, it has been clearly stated about the various differences with respect to doshic plane to assess the Ashuddha Stanyam. I'll just play this video. Can you see the video? Is it visible?
Yes, sir.
Okay, fine. So see, I have just instilled few drops of Stanyam to this glass of water. And what I told, if it is Shuddha Stanyam, it should form a uniform mixture, isn't it? See, it is trying to settle at the bottom of the tumbler. Along with that, we can see some thread-like formations, isn't it? Acharya says that this Tandumat or thread-like formation is the characteristic feature of a Vada Dushta Stanyam. See, the Guru Sabhavam of Stanyam is making it sink at the bottom of the tumbler. And the clinical picture is that the child is having a respiratory infection with a mild fever. On examination, on auscultation, we can hear the crepitations as well. This is the common picture which we can see in my OPD with respect to respiratory illnesses. And we can just make the parents sit beside us and do this examination and tell them that, see, if your breast milk is pure or if the breast milk is of good quality, it should form a uniform mixture. Tell this statement first, then do this examination. On doing this examination, the parent will get convinced that, oh, my Stanyam is a contributing factor for this particular disease, isn't it? Otherwise, what happens, especially in case of Kshira Ada as well as Kshira Annada, the intake of Kabha Medo Vardhaka Swabhava Aharas will be continuously happening in the case of mother, isn't it? We have 3 principles of Chikitsa. The first and foremost principle of Chikitsa is avoiding the causative elements or Nidana Parivarjanam Hi Chikitsa. So how can this be accomplished in a child who's not directly having any exposure to Nidanam other than the breast milk? The first step is making the parent convinced that whatever aharam you take definitely will be ending up in your breast milk because it is the upadhadu of rasam, isn't it? So definitely the breast milk gets vitiated due to intake of the respective aharas, which may end up in stanyadushti. And in this picture, you have seen this picture. I have more than around 860 pictures regarding the Stanya Pariksha. And interestingly, about 99% of such cases have the same presentations as well as the same Stanya Pariksha details. In this patient, the child was a 6-month-old child who was still a Kshirada, not a Kshirana. That is a child who is only on breast milk. The exclusive breastfeeding phase was continued even after 6 months of age. So I asked the mother to see this examination. I told her that the cause of the respiratory issues of your child is because of this Kabhamedo Vardaka aharas taken by you during the previous days. And in such conditions, advise them to stay away from all sort of guru snigdha aharas or vidahi aharas, which may end up in complications as that of a non-vegetarian food item, the curd, the tubers, or whatever type of guru snigdha aharam that is taken by the mother during the previous days. You have to convince them. Then give medicine to mother. Of course, the Vada Kabahara medicine given to mother, again, as that of an aharam, the Aushadam also becomes a part of stanyam, through which we can enter the body of the child through medication. This is the first step we have to keep in mind in addressing any type of clinical features in pediatrics, not just with respect to respiratory infection. That can be any type of presentation, including a constipation, an atisaram, or whatever it may be. Nidana Parivarjanam Chikitsa is the most important part. We often forget that and we feel that. See, parents used to ask, if you don't do Sanya Pariksha, and if we give medicine for a mother, parent will tell you that, doctor, I am not the patient. My child is the patient, isn't it? So you will get such queries and use such interesting, funny facts in between. If we have to convince the parent and make sure regarding this type of examinations and communications will not only help in addressing this particular event of clinical spectrum, but also when she takes some sort of aharam, this consciousness come to her mind that of course, my aharam will be reflected in my stanyam, so I have to take care of my aharas. Then, when coming to Aushadha Prayogam in children, you need not start a separate pharmacy or separate hospital or separate, separate medicine manufacturing unit to address pediatric patients. Because Acharya himself has told that you can address any type of diseases coming to a child with the same medicine that you have studied in your Kaya Chikitsa perspective. That is the second sloka. Ta eva dosha dushya jvaradhya vyadheschayed atastadeva bhaishajyam. The dosha, dushya, these that we trace out in respective diseases as that of jvaram up to vada vyadhi, the same thing is happening in a pediatric age group. The child is also having tridoshas. Child is also having 7 dhadus. Child is also having malas, of which the pradhana malas are 3 in number. So the medicines or the principles which we have studied from the context of Kaya Chikitsa is equally applicable in the case of pediatric case. But the important difference is that matra tu asya kaniyasi. That is, the dose should be less. The decreased dose, the reason for the selection of decreased dose is told as because of the sukumara swabhava, the vulnerable nature of the child. Alpakayatva, the small body mass index, which may not be able to accommodate the increased potency of medicine. Sarva anna anupasevanad, the acne as well as the koshtam, the intestinal flora is not congenial with all type of aharas or all types of Aushadha Prayogas. So these factors should be considered to make a fixed dosage for the child, and that definitely should be less than the adult dosage. And he also says that Rogamsha Asya Jayehi, all diseases that is happening in the pediatric age group should be treated with medicines which are Saumya as well as Avishadaka. Saumya means that is less potent. Avishadaga means Vishadam Janedi iti Visham, isn't it? So Avishadaga means it should not cause any Vishadam. On the other hand, if we go on translating, then that becomes a hello. Hello.
Yes, sir.
Okay, fine. Something happened in between.
Sir.
Okay, fine. Okay. So when we go on translating the concept of Avishadaga, it may end up in a term which we usually use it as palatability. The palatability should be considered, but don't forget that palatability is not the exclusive factor to be considered, because we often address pediatric cases just by thinking about the palatability. And we often give medicines with jaggery, we often give medicines with honey. But before this selection of this anupanam or the praksheba dravyam or the sahadravyam, we have to think about the property of this anupanam or sahadram which we are trying to reduce the vishadam of the medicine. This is very, very important. How can you address a kabhaja vigaram just by giving a jaggery to reduce the to increase the palatability? It is something which is contrary, isn't it? Because jaggery is having the ability to increase the kabha dosham inside the body. So in such cases, we have to use our intelligence, use our yukti to modify the drug which is given to increase the palatability. You can just switch on to madhu, or you can just switch on to something else which may not increase the kabha dosham. So such type of modifications should be there, even though we give priority to the concept of Avishadakar. Hope that is clear. Then, before entering to our concept, we have to think about the concept of Vayadosham as well as the Vyadhi Subhava. We know that when we classify the age group under three headings, Balyam, Madhyamam, as well as the Vardhakyam, the period of Balyam generally is having a predominance of all sort of Kabhadika Vyadhis, as well as Madhyamam shows the predominance of Pittadika, as well as Vardhakyam shows Vadadika Vyadhis. The best example to portray or to signify this change is we generally see degenerative type of conditions, all sort of Vada Vyadhis when the patient become adult, isn't it? Majority of the patients coming to Kai Chikitsa OPD or Panchakarma OPD will be of having knee joint pain, low backache, Shalyandra OPD, isn't it? At the same time, when students like you people, when if I'm correct, students are also watching this. When students like you people, will not be having such type of issues predominantly. Instead, you will be having issues as that of your hair fall. You'll be having issues as of pimples. You'll be having issues as that of your amla pitta swabhavam, acidity. See, the pittadika swabhavam is very common in the madhyama age group. Whereas in the pediatric age group, the most important presentation will be coming under spectrum of kabhadika vyadhis. We have to always keep this in mind. This is why generally the pediatric OPD, what I say, caters to the conditions as that of respiratory infections, krimi, ajirna, maknimandam and all, isn't it? This should always be kept in mind, because even though you are not getting a case of Kabhadika Vyadhi in Balyam, we have to keep this in our mind, because whenever we try to address some sort of diseases in the Balyam, the chance of a Kabha Vikriti should be there. Why? Because the Balyam itself is having a tendency to have a Kabhadika Vyadhi. This should be kept in mind. So even though the child is showing you some presentations with respect to Pittam or Vadam, we have to keep an eye on the vitiating, on the chance of the vitiation of Kabham, because the tendency of the Vaya Prakriti, tendency of the age group and Prakriti is to have a Kabha vitiation. This is universal. This is very much important in addressing any type of pediatric cases. Now, coming to the respective portion, Pranavaha Srodho Dushti Vikaras. It includes Kasam, Shwasam, Hikka, all sort of such issues, isn't it? Kashyapa says that it is very easy to identify a Pranavaha Srodho Dushti Vikaram from the context of Vedanadhyayam. He says that the heart feel that a doctor can encounter in the chest of a patient who is sitting in front of you may be a clue regarding a respiratory issue. Of course, I told you in the first slide itself, the Nidana Parivarjanam is the first step in addressing any type of diseases, not only with respect to respiratory, but in any type of illnesses. In this fast life or fast type of management, we often forget this, or unfortunately, we don't think about this particular dimension. We just address the disease with the Lakshanika Chikitsa, but I feel as quality Ayurvedic clinicians, society is asking for a change. Society is asking for some sort of demands to come out of the increased medicinal dependency of all patients. So in such cases, if we could utilize the thrust areas which was mentioned only according to our Ayurvedic principles, I think that that will be a game changer. So I request all of us, let me also be a part of this. Let us don't forget about the concept of Nidana Parivarjanam in addressing the cases. The exposure, we know the Nidanam of Kasam, Dhuma Upakada, Rajasas Tadheva, Vyayama, Ruksha, Anna Nishevanacha. Just have an idea that in case of exposure to Dhumam, Kasam will be there. In case of Rajaha, Kasam will be there. Ruksha Anna Seva, Kasam will be there. How can the disease caused due to Dhuma Upakhadam and Ruksha Anna Seva, even though it represents the same clinical picture, be treated with the same medicine or same principle? It is practically not possible. Sometimes in the case of a Dhuma exposure, we have to keep the patient away from such dhumam, and we have to give some sort of samprapti vikarana chikitsa there. What about in the case of increased vyayam? The increased vyayam itself is a vada vardhaka prayogam. In such cases, we have to address the increased vyayam. We have to ask the patient to have enough rest. Then we have to perform a vada pitta shamana prayogam in the case of a kasam that is happening due to increased vyayam or ruksha anna seva. The commonly seen nidanas, apart from the classical references, or the commonly seen nidanas which we have to keep an eye, at least in the respiratory issues which we commonly encounter nowadays, are, I feel that the post-viral fever, very, very commonly seen. Almost all cases when you see Kasam or Shwasam patients, you just inquire about the beginning of the disease. Most of them will be telling that the child had a fever, an episode of fever, which was addressed by some sort of medicines, most probably with the help of an over-the-counter paracetamol or Vamol or whatever it may be, some sort of antipyretics. They'll be giving this medicine and the fever will be addressed. What happens later? Once the fever is gone, the respiratory issue starts. Respiratory issue is very commonly seen with that of a very dry cough, which may disturb the child, and the dry cough may increase in such a way that it may end up in even this abdominal pain, like that. Again, a Vada Vriddhi Lakshana may be present in such case. This is very commonly seen nowadays, especially in this change of climate. And once the child is going to, especially in northern parts of India and all, we can see the increased pollution index and all, isn't it? There, the chance of more humidity, if there, then definitely the increased viral growth will be there, which may end up in such sort of infections in children who are having the immunocompromised status in general. Then other commonly seen nidanam is constipation. You might be knowing about the samprapti of Kasam, isn't it? Kasam has been studied, you might have studied Nidanasthanam and all. Adaha pradihado vayu. The first element which we have to clear out when a patient comes to us with Kasam is the Adaha pradihadattvam. That is the obstructive pathology that is happening in the pradhana srodas of vayu, the Vadavaha srodas or the koshtam. The Adaha Pradihadattvam is the causative element of Kasam. So we have to address this Adaha Pradihadattvam, or we have to address this obstructive pathology. That may be a physiological one. It may be an anatomical obstruction. If it is a physiological obstruction, of course, the Mudha-Vada Swabhavam should be addressed there. If it is a gross morphological obstruction, especially as that of constipation, we have to address the constipation first. In such patients, I feel that there is no need of giving medicines as a Dashamolakadatrayam Kashayam or a Vasharishtam or Shwasanandam Gutika. Instead, we can address such cases with Gandharva Hastadi Kashayam. We can give Abhipati Churnam. We can give Abhyarishtam like presentations. Why? Because there the constipation is the Swatantra Vyadhi as well as Kasam is the Paratantra Vyadhi. And of course, the all sort of Apatya Acharas which we encounter nowadays, the increased exposure to cold breeze while traveling in bikes or something like that, the increased exposure to dhuma, the chance of having an apatya aharam, all these things togetherly contribute to the current spectrum of the respiratory issues in children. And when coming to medicine, the medicines are generally Vada Kabahara, because we know, irrespective of the type of presentation, the sthanam is amashayam of any sort of respiratory issues. And the pranavaha strothas is lying in the urus, which is again a kabhasthanam. So generally, even though we have to look about the doshic predominance, the Vada Kabhaharatvam should be the line of management. So generally, our prescription will be having an inclination with medicines which is having a tendency to have Ushna Gunam, Laghu Gunam, as well as the Anabhishyamti in nature. And while coming to management, of course, the two spectrum of conditions which we see, the Jvaranubandhi respiratory issues, that is respiratory issues with fever and other conditions, as well as the respiratory issues with Vibandhanubandhi, constipation related. These are the two common pictures which we've seen. Sometimes patient will be coming to the OPD with respiratory infection and fever. Sometimes they'll be coming with constipation or the mode of other swabhavam and the fever and the respiratory issues. And always keep in mind about the two important concepts. Kasa vridyal bhavet shwasam. That is, if kasam is not hit properly, it may end up in shwasam. Then Vagbada also says that if the kasam is left alone, the chance of progressing this kasam to conditions as that of shwasam, kshaya or rajekshma, chardi, as well as swarasadam is more if we leave this kasam alone. That is kasad, shwasa, kshaya, chardi, swarasadadayo gadaha bhavanti upekshaya, tasmad tam tvarayajay. That is, if we get a patient with swarasadam, if we get a patient with chardi, if we get a patient with yakshma, if we get a patient with kasam, just inquire about a past history of kasam, which may be the Sudantra Vyadhi, which may end up in sequelae or the Ubadra Vyadhis as that of Shwasam, Kshayam, Chardi, as well as Svarasadas. Coming to treatment principle, as mentioned previously, check the Swatantra, Paratantra, dependent or independent condition of the disease and plan accordingly. That is, in case of a Paratantra Vyadhi, what is the purpose of selecting a medicine from the context or a prakaranam of kasam? Rather than we can check on the prakaranam of the respective independent Vyadhi. On addressing that independent Vyadhi, the disease becomes curable or the upashayam can be seen. As of any other diseases, the three important dimensions of chikitsa. The first one we have mentioned many times. The first one, Nidana Parivarjanam. Second one is Samprapti Vikhadanam hi chikitsa. Third one is Rasayanam. And I feel that we often lack the second principles or Samprapti Vikhadanam. Majority of the doctors nowadays are going behind the Lakshanika Chikitsa, which is not the exclusive Samprapti Vikhadanam or which is not the exclusive Shuddha Chikitsa. So I feel that Samprapti Vikhadanam should be given due importance. And Samprapti Vikhadanam can be done by addressing the obstructive pathology of Vayu, which is supposed to travel throughout the koshtam without any obstruction. And the Mahasrodha should be is a pradhana area of Vada dosham. And if by any chances obstruction happen, means we have to address that by the Samprapti and not just by giving the Lakshanika Chikitsa. And of course, even though the patient becomes asymptomatic, we are supposed to keep an eye on such patients just by providing a Rasayana Chikitsa to prevent the recurrence of such conditions. And even though we talk about all these things, this Hika Shwasas, which is coming under the spectrum of respiratory issues, has been told as a disease which is usually seen in a patient as a nearby death presentation. That has been told in Charaka Samhita as Mrityu Kale Kritalayo. Mrityu Kale Kritalayo. So the Shwasa Hikas are usually seen in a patient who's approaching death, means that much importance should be given in addressing any case of Shwasam and Hika. So of course, we have to think about some sort of emergency management, which is not contra with the basic principles of Nidana Parivarjanam, Samprapti Vikhadanam or the Rasayana Chikitsa. So the general principle is Hika Shwasardhidam, Snigdehi Ado, Svedehi Upajara, the common Chikitsa principle, which all of us will be knowing from the Charaka Samhita, isn't it? Svedehi Upajare, Aktam, Lavanadali, Nadi, Prastara, it goes like that, isn't it? So basic principle is addressing the Vada dosham as well as the Kapha dosham, because those two are the important culprits which may end up in a Shwasa Roga. And of course, When we discuss about any disease, we have to know the context from which we have to pick a medicine, isn't it? Patient is sitting in front of us. Patient is having fever means we will be going through all sort of examinations in our best possible manner, and we will find out that this is the dosham in this particular patient. From this doshic perspective, we will be having the patient is sitting in front of you with Vada Pitta dosha means Vada Pitta dosham can happen in a jwaram, in a rektapitam, in a kasam, in a shwasam, in a Vada where it goes like that, isn't it? From the understanding of the respective dosham in this particular plane, we'll be again going and searching in the respective prakaranam, or which is the adhyayam there. And from there, we'll be finding a conclusive medicine, isn't it? But discussing about the kasam spectrum of conditions, we have to keep an eye on the prakaranas as that of Shwasam, Chardi, Raja, Ikshma as well as Svarasadam. This is very, very important. Coming to the medicines and the common managements, the Vamanam, usually it is difficult to perform Vamanam in a very small child. Especially in Kerala, we don't have an upper hand in performing Vamanam even in adults. I think that the northern part of India is well versed, because I have heard that the northern people, they used to do Vasantika Vamanam and all. And I appreciate that, because we do have a fear in performing Vamanam, and Vamanam is not much practiced by the general practitioners. Of course, we have very eminent faculties or clinicians here in Kerala. They used to practice Vamanam in adults. But while coming to the pediatric perspective, it is difficult to perform the classical Vamanam in a pediatric age group if the child is less than, say, 4 or 5 years of age. But still, if the patient is telling you, or if you examine the patient, you can hear those crepitations. You can see those froth coming from the nose because of rhinitis. You can see the drooling in the mouth. All these indicates the cleanness subhavam of the kabham, isn't it? In such cases, I genuinely feel that if we could provide an evacuation of the basic, the vitiated kabha from the, at least from the upper respiratory tract, then after doing this, if you could administer some medicine, that will work far, far better than the medicines without performing this Vamanam or the Vamanopaga, giving Vamanopaga Aushadhas. I generally advise Yashti Madhu capsule of Himalaya is one of the best drug which I have seen with less complications. I will be giving 1.5 glass of water in the morning. I'll be advising them to add 2 or 3 capsules of Yashti Madhu capsule. Just I will ask them to break the capsule and take the powder itself, and I'll mix it. I'll advise them to mix it in this glass of water, lukewarm water, and I'll advise the parent to administer this lukewarm water of Yashti Madhu capsule mixed drink, so that the child be having some sort of mild Vamana Vekas. Because even though Lavanodagam is a good choice, because of its decrease in palatability, the Avishadaga Swabhavam, the Vishadaga Swabhavam of Lavanodagam prevents its acceptance as one of the medicine which we can give for performing the Vamanam. So Yashti Madhu capsule is a very good example. See, all these things, sometimes we'll be having a fear. If somebody is having a fear of doing all these things, if you have a close encounter with the patients whose patients and mothers, they'll be telling you that, doctor, my child started vomiting, and once the vomiting is over, he feels much comfortable because his channels feels clear, his phlegm came out, and he feels much comfortable. That is the common picture which we can see in patients who are having more of upper respiratory with Kabhadiga dosha. Then after performing the minimal Vamanam or the Vamanodvamanam, we can give medicines as that of Dashamula Kadatrayam Kashayam, Vyakriyadi Kashayam. Dashamula Kadatrayam Kashayam is a more Ushna Subhava Kashayam which is having Vada Kabahara Subhavam. Of course, Dashamula Kadatrayam Kashayam should be given with its respective Anupanam, which is honey, which is highly potent in reducing the Kabha dosham inside the body. But because of its Ushnadikyam, have an eye always on the Pitta dosham on giving Dashamula Kadatrayam Kashayam. Vyakriyadi Kashayam, as we all know, Vyakriyadi Kashayam is the, we have very few Kashayams with the Vada Kabha Haratvam as reference in its indication. I feel that only 2 or 3 Kashayams are the classics which is having the indication as Vada Kapaharam. Even though we select many Kashayams to be given as Vada Kapaharam, Vyakradi, Pastyak, Patyak, Kustumbaradi, all those are some Kashayams in which we, in the reference itself, we can see these medicines are Vada Kapaharam. So Vyakradi is a good drug of choice, especially in case of the viral fevers which is happening nowadays. It is having a high potency to address such type of fevers. But of course, don't forget to add the Pippali Churnam. Pippali Churnam is the Praksheba Drivim in Vyakriyadi Kashayam. You can add Pipali Churnam based upon the condition of the child. If you have a very sensitive costum or very sensitive child or a very small child, preferably don't add this Pipali Churnam because of its high potency. And in the previous slide, I mentioned that even though you get a case of Kasam, we have to think about other dimensions as well. Out of this, the current cases which we are seeing nowadays, I feel that the medicines from the Pragaranam of Kasam will not be enough to address such cases. When you encounter with such an instance, I feel that you have to refer the context of Rajekshma or Yakshma Chikitsa. There, the medicine says that of Ela Kanadi Kashayam. Ela Kanadi Kashayam is a high potent drug which is having Srodho Shuddhi, and it is able to address a kasam which is having an affinity to become a Rajekshma presentation. So, Ela Kanadi Kashayam is one of the most commonly prescribed medicine nowadays in my OPD because it is found to be highly effective in such type of kasas. And don't forget to add the Praksheba Churnam of Ela Kanadi Kashayam, which is the Lakshadi Churnam. Lakshadi Churnam is available in the market, it is marketed by Vaidyaratnam. So if you add, say for example, in the case of a 5-year-old child, if you are giving Ela Kanadi Kashaya means you can give around 5 to 7.5 ml of kashayam with 3 times or 4 times with boiled and cooled water, and add say quarter to half teaspoon of lakshadi churnam as well as honey to this particular combination, and that is found to be highly effective in today's type of kasas. Of course, the medicine sthiradi kashayam can be given in type of this cardiac asthma-like presentations or in very small children who are having congenital heart diseases along with the current viral fever, post-viral respiratory issues. Niobhayam Kashayam is having a very good Vata Anulomana property, and there are 2 formulations of Niobhayam. Don't forget this. In the market, both these medicines are available, so we have to keep an eye on the respective yogam. The medicine which we can give for pediatric as well as the Garbhini comes from the context of Arogya Raksha Kalpatru. Coming to Arishtas, of course, we have to check the basic principle of giving an arishta, which is a Madhya Kalpana. The Madhya Kalpana Vishesham is having the same property as that of Visham, isn't it? That is why Madhyam and Visham are having the opposite property as that of Ojas. So, we are addressing a pediatric case. We have to keep that in mind. So, when we give arishtam, we should make sure that the child is having a physical built and potency to have an intake of arishtam. So generally, try to avoid arishtas in Kshira and Nada. Of course, in the case of Kshira, that is 100% contraindication because it is a very vulnerable group. Coming to Kshira and Nada also, we have to keep an eye on the condition of the child, then we can prescribe the arishtas. And I feel that Annada onwards, it is a good drug of choice because it is more palatable. Because of its decrease in pH or acidic pH, it is one of the best bioavailable element in the body. So that arishta comes into play, and you can give kashayams with arishta combination just to increase its bioavailability. Such type of modifications can be made based upon the patient who's sitting in front of us. The most common ones we all know: Vasharishtam, Kanakasavam, Dashamularishtam, Punarnavasavam, Surasasam. Even though we can't classify the medicines in the arishtas with respect to the Oshik plane because it is a very fast acting and the action of this medicine is far beyond the narkansa. This is why generally in Rasa Ushdas and arishtas we don't have a clear picture regarding dosha haratam. I believe so. But still, there are some instances where we can say this will be a very good drug of choice. Surasasam is a very good drug of choice which is manufactured by Vaidyaratnam company. Surasasam is a good drug of choice in upper respiratory issues as that of a rhinitis or upper respiratory cough or whatever it may be. It is a very good drug of choice. As well as Partharishtam, I forgot to mention the particular name Partharishtam here. It is one of the best drug of choice in case of respiratory issues associated with the cardiac issues or whatever the minor ASD, VSD like conditions or conditions as that of a post-viral issue. Partharishtam is a good combination. Then there are some of the very commonly prescribed patent drugs are Shwasamridam, a patent drug of Vaidyaratnam. It is having again a Vada Kapahara Swabhavam, but it is not Pitta Pragopam. It is having almost the resemblance as that of Veshamulakadatrayam Kashayam. It was told by many teachers in many presentations, and I also have experienced the same. It is having a more Vada Kapahara Swabhavam without causing a Pitta Pragopam. Respicot is a medicine from Kottakkal Ayurvedashala. Respicot is a medicine which is having the same formulation as that of a Vyakriyadi Kashayam, but it is not that much palatable. It is having a bitter taste on the other side. Vashakot is another medicine from Kottakkal Ayurvedashala. It is more palatable and more sweet in taste. Generally, we give Respicot for a productive cough as well as Vashakot for a very dry cough. I used to give it in mixing up because it increases the palatability. In very small children who are hesitant to take kashayams or something like that, these combinations are found to be very effective when we compare with the results and all. Cough heal is a medicine which is from the Ayurvedic pharmacy, Coimbatore Ayurvedic pharmacy. I used to give cough heal even in very small, very newborn children, especially neonates and all. I used to advise coffee because I have experienced the quality of coffee in my clinical practice. It is very difficult to get this medicine, but it is of a good quality. In even in neonates or in the infants, we can very easily give coffee in just small 1 or 2 drops or something like that. Coming to the respective gulikas, I have very bitter experiences in addressing the condition with Shwasanandam Gulika. I feel that it may be because of my less experience in giving Rasaushadhas, especially being a person who's more trained in herbal medicines than the Rasaushadhas. I feel that Shwasanandam Gulika, when I inquired about the action of Shwasanandam Gulika with my teachers and all who's Shastra experts, they told me that Shwasanandam Gulika is a medicine which contains Hingulam as well as Valsanabham. At the same time, it contains Karpuram and it doesn't have Tanganam also. So they told that if we don't get quality, the ingredients for this preparation of Shwasanandam Gulika, definitely that may end up in some complications. So unless and until you are not sure about the quality of Shwasanandam, try to avoid Shwasanandam Gulika in your practice with respect to respiratory illnesses. Mukkamukudagadi Gulika is a far safer drug without any Rasaushdas. The reference is Sahasrayogam. It is very commonly available in the market as well as one of the safest drug, which is having an indication as Sannipada Jwara Kasahara. So it can be administered in a respiratory issues with a fever condition. Dhanvantaran Gulika, in the current picture of this high cough, dry cough, Dhanantaran Kulika is helping us a lot because being a government doctor, a government practitioner, I don't have access to many drugs in my government practice. Dhanantaran Kulika is one of the best drugs which I have found in my clinical experience in addressing the acute phase or the casualty phase of Kasam. Nimbarajanyadi is a very high potent drug which is having an affinity to reduce the kledam, dushta kledam inside the body. This is why we used to advise Nimbarajanyadi in allergic type of coughs. Gorojanadi Gulika is having a Vada Kabahara property. Again, it is very good in as that of a Dhanantaran Gulika. And you might have seen patients coming to you and telling that, doctor, my child is having cough, and especially the cough is more during the night time. He is comfortable while sleeping, but once the initial course of sleep is over, he suddenly wakes up with cough, and sometimes this cough may end up in vomiting. That is known as post-tussive vomiting. In such patients, along with your classical respiratory system examination, please check the nostrils of the child as well. In majority of such patients, you can see this picture. That is the nasal turbinate hypertrophy, which is happening from the lateral walls of the nose of the child. In such cases, whatever you give, whatever type of respiratory medicines you give, usually that is not found to be that much effective. Here, the reality is we have to address this nasal turbinate hypertrophy with the principles of a Nasagada Shobham. So try to give medicines as that of some medicines that can be given for nasal instillation. The normal saline drops may itself will help the child to get a good amount of cure. Along with that, take this as a type of typical Vadika Kasam and advise some sort of Sneha Prayogam which is having Pajanine property. So Kshirabala 101 Avarti, Dhanvantaram 101 Avarti. Once the Avarti becomes Avarti happens, that means that is a method to increase the Sukshmata of the medicine. So if we could advise such medicines which are again a Sneha Prayogam, that will work well even in an Amavastha, but the Amavastha is caused mainly due to Vadadosham. So the conditions as that of a very dry cough, which is acute of onset, the child is having good appetite and all physiological functions normal, still child is having cough, means there don't try for a kashayam or arishtam or something like that. Instead, if we give some sort of this Pajana type of snehas, there you'll get very fast relief as that of Kshirabala Avarti or Dhanandaram Avarti. Then the very common churnas, we all know very common churnas, Talisa Patradi churnam is more of Vada Kavaharam. At the same time, it is having an indication of Smudha Vada Anulomanam. It is Deepanam as well as Pajanam. If you see a Pitta Anubandham, preferably don't go behind Talisa Patradi churnam because it may vitiate the Pittam. At the same time, Sitopaladi churnam, which is manufactured by Aushadhi and many companies in northern part of India, is found to be good relief in Pitta Anubandha Kasam, especially in Kasam that is arising due to Amla Pittam and all. There you have to give medicines as a Sitopaladi churnam. Rajanyadi churnam, which is one of the very commonly prescribed drugs when a patient is of pediatric age group, we have to keep an eye on Rajanyadi churnam because Rajanyadi churnam is not a medicine which is having that much Pajana property or potency. It is having Deepanam as well as Rasayana property. So sometimes Rajanyadi will not be giving you that much result that you are expecting in an acute case of a Amavastha. This is because of the fact that it is not that much Pajanam. Vyoshadi Padakam is more of Kadu Rasa in nature, but it is having more Pajanam, especially in the Urdhva Jatrugata Pravartamana dosham, as that of a rhinitis or a nasal blockage or whatever it may be. It is a very good Pajana Aushtam. Of course, some patent drugs coming under the powder spectrum, including the Alarkhan powder of Sitaram and all, it works well. Then a very common home remedy which we can give in a Vada Kapakasam is Vyosham plus Haridra in equal quantity. It can be powdered and mixed with honey and can given. Don't forget about the Aushadha Kalam and all. We all know in the Vega Avastha, in the diseased phase, the Muhur Aushadha Kalam should be considered. Whereas in the Avega Avastha, to address the Samprapti, the Dosha Vishesham should be again considered. Then some of the rasayanams, including Mridvikadi Rasayana, Agasti Rasayana, Haridakyadi Rasayanam of Kotakala Ayurvedashala, Dashamula Rasayanam, Eladi Rasayanam, all these things can be taken into consideration. Generally, on giving this lehyams, what I prefer is I'll be advising the patient to mix some quantity of Arishtam with this lehyam to make it more palatable. At the same time, we can reduce the quantity of medicine as well. Because I told you, Arishtam is a formulation which is having an affinity to increase the bioavailability. So I feel that modifying medications accordingly will definitely help us in increasing the absorption level. The Gridas as that of Rasna Dashamula Gridam, Vidaryadi Kridam, Indukandam Kridam, and Shatpalam Kridam should be the drug of choice, especially in the case of Rasayana context. The Rasnadi Kridam, which is available in the market, there are two drugs in the market. Vaidaratham Aushadashala prepares the Rasna Dashamula Kridam, which is from the context of Kasa Pragarnam. At the same time, majority of the companies preparing Rasnadi Kridam will be from the Vada Vyadhi Prakaranam only. So, Rasnadi, if you are addressing the Rasayana perspective of Kasam, we have to select a medicine which is having the Rasna Dashamulam as the content. Then the general talas. For example, I used to advise Rasnadi Churnam as talam. I used to advise Rasnadi Churnam, Kachuradi Churnam, Panjagandha Churnam. But the importance is that the selection of the Sahadrevyas. For example, Rasnadi Churnam, if the Sahadrevyam is Shigrusvarasam, if it is of Shigrusvarasam, I feel if your patient is coming to you with increased rhinitis, that the phlegm is more yellow in nature, it is more of thick in nature, we have to select a talam which is having pravartana in nature. Shigru is a pravartana dravyam. So mixing the Shigrusvarasam, the Agnis of the Shigrusvarasam with the Rasnadi Churnam and applying it talam over the forehead, say after 5 or 10 minutes, we can just wipe it up once it becomes dry. Repeating it means the patient tells you the doctor, once applying this talam, this productive phase increased. And once the patient tells you once it becomes watery means you need not continue with the Shigru. Instead, you can switch on to some other Pajana Dravyas as that of Jambiras or the lemon juice and all as talam to completely address this condition. All sort of Svedana mechanisms, Grananam, the general inhalation methods with very commonly available patent drugs as that of Halin drops, nostril cap of cortical can be used. Shwasahara lepas. In very small children, it is difficult for us to address the Ateka phase as child be hesitant. Of course, he'll be cranky. In such cases, to address the chest congestion, there is a formulation which is time tested, and I have experienced the beauty of this particular combination known as the Shwasahara Lepam. The technical name is Jatyadi Ilanir Lepam. The contents are the following. The following drugs are that is mentioned in Arogya Raksha Kalpadrumam. We can make this a powder, and this powder is made into a paste with the help of coconut water. This can be used as an external application. The external applications are very rare in diseases as that of Kasam or Shwasam. We can see external applications in Shvitram, Kushtam, Vadavyadi, Vadaraktam and all, but it is very rare in Shwasa Chikitsa. So this is very much important in that particular context. And I have seen the child having a relief from the congestion of the chest on applying this external application. Hot water enema with Jampiras Varasam. I have a few experience in patients coming to us with continuous hiccup. The basic principle is, I told you the basic principle is Samprapti Vikhadanam. In that, the Adaha Pradihadattvam of Vayu, even though you cannot see an anatomical obstruction there, no constipation, but still, the Mudhavada Swabhavam is obstructing the normal passage of Vayu throughout the intestine, throughout the Koshta Mahasrodhas. There, the enemas, the Basti type of preparations, which is having Ushna Swabhavam, which is again Vadanulomanam, Jambiras Varasam, the Ambla Swabhavam of the Jampiram is Mudhavada Haram as well as Pajanam. Such type of drugs can be selected for. And of course, we used to do nebulization with Arkam in our OPD for children. I'll just show you one video of how I perform nebulization. Generally, the common drugs which I select for nebulization includes Vasha, not Kanaka nowadays. I use Vasha Arkam. I use Bharni Arkam. Then I, of course, use this Parnayavani Arkam, that is the Indian Boresh. These are very commonly used by us for performing this nebulization. It is very easy to perform this nebulization because majority of the patients will be having the machines with themselves, because nowadays this is very common. Everybody is having some sort of respiratory issues in their family. So they'll be having this medicine. It is the safest method. This has been used just as a demonstrative purpose. That is not a true patient. You can just connect it as that of a normal nebulization mechanism. You can connect it and you can advise it in your pediatric patients. It is very pleasant. Of course, if you add some sort of this Parnayavani, it is very pleasant to give this. There is no need for putting the mask and all. It comes out now. You can see it is not fitting to the child, comes out. There is no need for putting the mask. If you can provide a place where there is no much ventilation and all, even though that cannot be a Nivata Agaram, there can be a room with less ventilation, there this can be utilized. It takes around, say, 15 or 20 minutes to complete this nebulization. In our OPD, patient used to come as out of an allopathic hospital to have nebulization with the Ayurveda, this Arkas. We don't market this, but I have seen the magical experience of Arkam nebulization. Generally, for upper respiratory, I use Parnayavani. For lower respiratory, I use Parnayavani plus Vasha Arkam. And of course, in case of the severe asthmatic cases and all, if we are able to address that case, or if we feel that confidence, or if we get a space to give some medicines, definitely I will try for Bharni. Bharni is there in my OPD. I used to advise that. So by this, I come to the end of a presentation, and I would like to invite, now it is 4:05 sharp, I have concluded my session within a period of 1 hour. So I'll be more than happy if I could interact with some of the audiences there if they wish to have to clear some doubts or something like that. See, I'm not a very experienced clinician or something like that. I am a person who's having just 10 years of experience. And out of my passion, I'm trying all these things. And I'm fortunate to meet such type of cases in my OPD. With minimal resources. That is the interesting thing. I don't have much resources, or I don't have a commercially or economically friendly persons coming to us. They'll be coming from the very lower socioeconomic group. So this is my humble attempt in addressing such cases. So thank you so much. So let us have some discussion in between.
Yes, sir. Thank you so much for a wonderful presentation. Now the topic is open for discussion. I request to participants, if anybody have any doubts, they can put in the chat box. Sir, already we have one question. Can you tell how to prepare arka in home, sir?
Actually, in my experience, I prepare arkam not from my home. I have a person who prepares arka for me, and I don't feel it is a difficult task. But of course, the method of preparation should be checked in. Majority, I have seen many clinicians in Kerala preparing arkam with the help of the pressure cooker that they have at their home. But I feel that if you have the assistance of an arka yantram, almost all Ayurveda colleges are having Arka Indras, and many clinicians are preparing Arkam. Many are marketing Arkam. And when I discussed about such possibilities with the respective persons who are preparing Arkam, they told that they have experienced a compromise in quality when you prepare Arkam with the pressure cooker or something like that, because of the quality of the vessel, quality of the casket, everything influences there. So I feel that Arka Yantram is a good method that can be adopted for preparation of Arkam. If you wish, I can share the number of person who was preparing Arkam for me. I may share that number with Dr. Shinas.
Please, sir, share in the chat box, sir.
Sure,
Participants can be used that one.
sure.
Still more questions are there, sir. What is the minimum dosage administered in children at different ages?
What medicine?
They have not specified any medicines. I think they want dosage, sir. I think all told medicines.
The thing is that, as Madam will be knowing, she's smiling at me because she knows the challenge that happens in advising the dosage. See, the basic concept is we are dealing with the physiological entities, not as an anatomical structures, isn't it? We have to think about the Agni Balam, Koshta Swabhavam, everything before deciding the dose. So I feel that even though you get a twin patient of same age, from the same womb, from the same day, from the same second, still we will have to seek about the subjectivity of the patient, and we have to decide the dose accordingly. But in general, I can say a framework for that, depending upon the type of preparation. Of course, Kashayam will be having a wide spectrum. You can get a bottled Kashayam, you can get Sukshma Churna Kashayam, you can get the Kashayam sachet, you can get the coarse powder, it goes like that. So it's difficult to explain about the specific Kashayams. But while coming to Gulika and all, here again, depending upon the potency. For example, Gopi Chandranadi Gulika may be given with a dose of, say, half or one tablet for a 1-year-old child thrice daily. But that may not be the same dose in the case of Vetumaran Gulika or in the case of the Gorojanadi Gulika. Because why? There the condition, the medicine itself is a different one, which is having a high potency. And coming to Arishtas, again, the Arishtam which is having more quantity of this less pH or more quantity of alcohol content will be, we should reduce the dosage in such cases. So it is a very difficult question to answer in such a way regarding the dosage and all. But we can try some formats starting with a minimal dose. You can start with a minimal dose, you can gradually increase the dose and make sure that you are giving some sort of adjuvants to protect the harmful effects of an increased dosage. Generally, in case of a Vata Kapha Jwaram and all, I used to advise Vetumaran Gulika. But I am not sure about the company from which they are procuring Vetumaran Gulika. That is a challenge. So I feel that to address such type of conditions, you can just modify some medicines. For example, I'll give Vilwadi Gulika with Vetumaran Gulika. If Vilwadi Gulika is added to Vetumaran Gulika, means that is found to be highly effective in reducing the dosage. So there I am giving a herbal formulation to reduce the dosage of a Rasa Aushadha. So such things is done just purely based upon the experience or the cases which you encounter in your clinical practice.
Thank you, sir. Sir, can you please mention all arkas can be used in respiratory conditions?
I have just mentioned all those things. I will just explain it once again. The four important argas which I have clinical experience are Vasham, Vasharka, Kanaka Arka, then Bharni Arka, as well as Parnayavani Arka. But nowadays I don't use this Kanaka Arka because I had a very bitter experience of the child going fainting on using the Kanaka Arkam. So I don't know whether it is exclusively because of the usage of Kanaka Arkam, because I don't know whether others have experience on using Kanaka Arkam. But if you get a very bitter experience and if you get a very good choice on the other hand, why should you stick on to a risky element there? So I feel that the Vasha, Parnayavani, Bharni are the good choices which I use in my OPD. And of course, Barney is a drug which I advise. Barney is very difficult to procure, Barney Arkam and all. It is a very seasonal drug also, and it's difficult for us to procure Bhargi in our locality. So, Bhargi Arkam I advise in cases of this Shwasam-like presentations, Shwasa Vega-like presentations. Whereas in case of this upper respiratory issues, I give Parnayavani-like presentation, like Arkas. If it is a lower respiratory without that much effortful breathing and all, Vasha and Parnayavani combined is a good choice.
While using Arka, we need to add sterile water to it, sir.
No, nothing. Can be given as such.
Other than Arka nebulization, what other methods can be adopted in an emergency?
Emergency, I told you in the case of emergency, the basic Vata Vyadhi Chikitsa is the method. We can do some sort of Sweda Kriyas, that methods as that of a Hasta Swedam or a Pada Swedam can be equally adopted in such cases. And see, I'm a person, I don't have any experience with the modern medicines or modern preparations because I practice exclusively Ayurvedam in my OPD. I don't advise any modern medicines. So I have not much encountered with such emergency situations in the OPD. And whatever situations I have seen in the OPD, I was fortunate to address with the minimal medicines there. Dhanandaran Gulika like preparations are found to be highly effective. Siddha Magardhajam like combinations along with Dhanandaran Gulika was found to be highly effective in especially Shwasa Vegas. Kasturi Kalparasanam is another combination. Kasturi Kalparasanam, I think Kashmir Pharmacy and other companies preparing Kasturi Kalparasanam. It is having a very great property of reducing the kabham inside the body and slow the Shodaka property. So these are modified based upon the demand as well as the capacity of the clinician who is sitting in the OPD and the availability resources as well.
Any rasayana preparation can be provided to improve immunity with respect to allergic rhinitis?
Sorry, madam?
Any rasayana preparation can be provided to improve the immunity with respect to allergic rhinitis?
I was discussing about the Lehyas. See, the Lehyas as that of Agastya Rasayanam, Haridakya Rasayanam, Dashamula Rasayanam, all those are good choices. But nowadays I experience the Haridakya Rasayanam of Kotakala Ayurvedeshala is found to be highly effective in such cases. And the combinations of Gridam and Lehyam. For example, you can mix equal quantity of Indugandha Gridam as well as the Agastya Rasayanam that is mixed equally and that can be given up according to the condition. But don't forget that you are giving a Guru Snigdha Madhura Swabhava Aushadam. So always there is a chance of having a Kabha Visheshan. Already there is a chance because of the Kabha child is on the Kabha predominant stage. You are giving a medicine. So always keep an eye. Don't give an increased dosage. Take a break in between. Don't make it as a satyam as that of an aharam. So that always happens because we think that parents always think that the child should be disease free always. They always take their children to be as those to be kept in shockies or something like that. They should be disease free. See, always think about the concept of acquired immunity, which is very much essential for a human being. So we have to communicate the same thing. The interesting thing is that if you preach some sort of rasayanas with the fact that by giving this, there is no chance of a further infection or further disease means they'll be sticking on to this medicine. Even the child is having fever after some instance, that is an amavastha. In that amavastha, also they'll be continuing the same Guru Stigdha Sabhava Ahara or Aushadham. That itself may be a contributing factor to increase the amavastha. So have an eye on all these things, have a proper advice to the patients as well. Then you can continue such medicines.
Thank you so much. Just we will wait another 2 minutes if any questions come.
Nasya medicine role in emergency. Sorry, madam, I don't have an experience in giving Nasya Aushadas in respiratory issues, especially in cases of emergency. I feel this medicine as that of Nasyam. I used to advise very commonly available patent drugs as that of this Brisol and all Brisol, Himalaya preparing Brisol, NS. But of course, that is not in an emergency situation. that contains this Parnayavani as well as HT Madhus there, and normal saline water. In respiratory issues, I don't have an upper experience with respect to Nasyam. But of course, in a non-emergency condition, as that of a patient, which I have mentioned previously, if the patient is having nasal turbinate hypertrophy, something like that, of course, the instillation of medicine is found to be highly effective. Because I feel that irritation we will be triggering the irritation when we provide Nasyam, especially in the upper respiratory tract, that may increase the condition, especially in case of pediatric cases. Kramikna Chikitsa, excellent question. Sorry, I forgot to mention about Kramikna Chikitsa in practice. In this respiratory issues, if you feel that a proper Krimihara Chikitsa is not practiced, means the best drug of choice is, of course, a Krimihara Aushadam, which may comes under the spectrum of a Gulma Chikitsa as well. I used to advise Nirgundyadi Kashayam. Nirgundyadi Kashayam is a very good drug, especially in respiratory infections, if you feel the presence of a incomplete deworming Kramikna Chikitsa there. It is a wonderful area which is not that much touched when a patient comes with respiratory issues. We forget about Kramikna Chikitsa in such cases. Thanks for reminding this. Kramikna Chikitsa plays a very crucial role in addressing such cases.
What we can use in bronchial instead of steroids inhalers for a long time?
Understood. I think that don't just compare with an inhaler with some sort of Ayurvedic packages or inhalers. The sticking on to the principles of Chikitsa, because it is a pure case of Tamaga Shvasam, especially the bronchial asthma, the close presentations resembles or mimics the Tamaga Shvasam. So addressing the Tamaga Shvasam with the basic principles of Ayurvedic medical management, as I have just covered the same thing throughout my session, the same principles can be adopted. And but interestingly, don't forget the fact that the steroids are high potent medicines. If the child is on long-term steroids, means his or her body will be itself be tuned with the presence of with the action of such medicines. So don't try to stop such type of inhalers in the initial phase of our treatment. Just because we are Ayurveda doctors, it is not like that. We should not stop such medicines in the initial phase. We should stick on to those medicines until to a phase when child becomes asymptomatic. That is what I used to advise them. Then slowly we can have a slow shift from the this antibiotics or antihistamines or steroids or whatever it may be. Generally, the Budecort type of inhalers are advised by the allopathic counterparts in addressing bronchial asthma. See, this is not an issue between Ayurveda or allopathy. This is an issue of the life saving of a particular patient sitting in front of you, isn't it? So in an emergency, I feel that if the child is on some sort of inhalers, convince the patient, console the patient, tell them that, see, if you could follow the basic principles, which I'm going to explain to you, definitely your child can come out with some the increased usage of such modern medicines. With my very minimal experience itself, I have seen this. So I strongly believe that the method which we adopt classically in our Ayurveda OPDs is strong enough, or it is good enough to withdraw the patients from this modern medicines, but should be made in a sequential manner. Even in case of this antihistamines, I don't recommend them to stop antihistamines all of a sudden, especially the Montair, Montelukast, even the less potent drugs when compared to steroids and all. I don't advise. I advise them to start our medicines. Then, based upon the clinical presentation, you gradually can taper the medicine if the patient is not willing to go to an allopathic doctor, or if the patient is willing to go to an allopathic counterpart, I will tell them that you go and meet the allopathic counterpart and ask them, tell them that your symptomatic child is far better. Can I reduce the dosage? You can do it accordingly.
Can the usage of and Sweden on just
Yes,
relieve the
madam. Of course,
emergency?
that was what I have mentioning about the typical Vada Vyadhi Chikitsa. The general Vada Vyadhi Chikitsa principles as that of Vadasya Upakramaha, Sneha, Svedaha. So this is the same thing which was told in Hika Chikitsa as well. Hika Shwasardam Snigdehi Ado Svedehi Upajaret Aktam Lavana Dailena. Majority, if the patient call you at night and all, and if they don't have an hospital access, if the aggravation of Shwasam is there, the advice which generally most of us giving will be, we'll be advising them to apply some this sesame oil or with a karpura mixed something externally, but making it what I say, making it lukewarm, and then the Swedanam will be advised in such cases. That may help in to some extent, but of course not in cases of respiratory infections with fever.
Recently saw a lot of kids having throat ulcers. We deal with, sir.
Hope let us stick on to the specific topic. From discussing the specific topic, what I can connect is the increased usage of medicines, high potent medicines, as well as a decreased intake of water. It is very commonly connected nowadays. The basic nature of Asyapakam or the prana that is happening inside the body may indicate a Saumya Dhatu Prashoshna that is happening inside the body. This Saumya Dhatu Prashoshnam will definitely be because of a decreased intake of a potent thing which may increase the Saumya inside the body, or due to an increased intake of a Ruksha Bhava. And especially in children who are having this inhalers and all, I have seen large number of such patients with this mouth ulcers. So sticking from the respiratory perspective, I feel that the increased potency of medicine should be checked there. At the same time, we have to check about the quantity of water. Sometimes they'll be having an increased intake of ruksha aharas as well. They'll be having an increased quantity of fried items, biscuits, breads and all. Of course, the intake of such ruksha aharams, in such cases, the body will be having a high demand of this liquid water. If that is compromised, means the body will reflex in its own way. And that reflection is mainly seen in two important dimensions. One may be a case of constipation. See, 99% of constipations in a newborn child is due to decreased quantity of fluid intake by mother. That is very commonly seen. So if you get a patient with constipation, means first you have to advise increased quantity of water. Then constipation comes down. What does that signifies? The increased dukshada inside the body can be addressed by just by giving a supplement of water, which may help in improving a Saumya Dhatu inside the body. The same principle can be adopted in the Asyapagam as well, if that is due to a decreased fluid intake. On the other hand, if it is due to the increased intake of modern medicines, means we have to manage it in two different way, I feel, because being an oral cavity, the child will be hesitant to take food. You can try for some sort of supportive measures, as that of local ointments are very commonly available. We have very common drugs, smells, stomach tabs, so many things are available in the market. Local applications of such medicines can be given. At the same time, don't forget to compromise some of the prashoshnam happening inside the body. I hope that I'm not deviating from the particular topic, isn't it?
No, definitely.
Because whenever we get such presentations, queries will be coming in various dimensions.
I think why they have asked me is because of continuous cough, there will be a throat ulcers. Is there any remedies for that, sir?
The thing is that, yeah, okay. In that case, usually that is seen in night cough patients because they'll be bypassing the nasal intake. At the same time, they'll be having small ulcers of throat. See, this is a paratantra vyadi. We cannot just address the throat ulcers leaving behind the concept of kasam. So the addressing the kasam in its technical manner with giving some sort of alleviating or supportive measures will be working in such cases. In such cases, what I generally used to advise is giving honey with the turmeric powder. I advise honey with turmeric powder, and that is given in muhur quantity, which is having a robana swabhavam as well. So the inner ulcers can be addressed accordingly. Thanks, madam, for adding that.
Okay, sir. Thank you so much. Just we will wait another 2-3 minutes, sir. Any questions?
Sure. I'll be more than happy to interact with such persons because it is not that much easy to get a wonderful audience there, isn't it? Even though we go for many presentations, we'll be encountering so many chat box open there, but still no response from the other side means it's a painful event there. Yet is very happy to be here.
They are getting wonderful stuff, sir. Any particular oil or for head should be suggested in cases of Swasa Kasa in children?
Excellent, excellent. I appreciate that. The thing is that, see, basically in case of Shwasam, especially in case of a Vega Avastha or a Punadavartaka Swabhava or a recurrent case of Shwasakasam, the common picture which we encounter in our OPD is whenever the parent try to use an oil on head, it aggravates. That is, so generally I advise don't use any oils. But you will get a phase or you will reach a phase where oil is a good choice. Of course, that comes under the Rasayana Chikitsa or a Vadadika Kasa Subham, where of course you have ruled out possibilities of having Kabha Visheshan. The medicines as that of Tegaraja coconut oil, Shwasanandam coconut oil, all those drugs are effective in such cases. That is a high potent drugs. At the same time, minimal potent drugs as that of Asaneladi, Tribhaladi, all those drugs can also be tried off in such conditions. But make sure that, and interestingly, I forgot to add something. There is a study at National Institute of Panchakarma. Dr. Deep Sir had made a study, and he told that the chance of recurrent respiratory infections in an adult as well as a child can be addressed by one method to modify is you should advise the patient to have the head bath first. Have the head bath first, advise them to wipe it out, then advise the parent to carry out the body bath. Head bath should always be made with a boiled and cool water, not a warm water as well as a cold water, boiled and cold water. The body part should be made always with a warm water. This was the advice that was made by him. This helped him. Actually, this was a study that was made by him with respect to some refractory errors, some Shalakandra perspective. This was an add-on finding in his experience. And he told that never advise the patient to have his head bath in the evening hours, because after having a head bath in the evening hour means you are getting your body exposed from an Ushna Virya Swabhava of the daytime with an increased Shita Swabhava. There is a Virya Viruddha Swabhava that is happening in the evening. At the same time, this Virya Viruddha already happened there. At the same time, we are going to a phase where the coolness of the night is there. The Shida Ruksha Swabhava of the night is there. This again may aggravate the Shwasa type of conditions. So in Shwasa Rogas, never advise for a head bath in the evening hours. And always make sure that the head bath is made first, followed by the body bath.
Sir, what is the alternative for recurrent tonsillitis for which patients testing tonsillectomy?
The common picture which we encounter is the posterior pharyngeal tonsil, that is the adenoid hypertrophy, is the most common thing in that spectrum which we commonly encounter. I feel that generally we always stick on to the principles from the context of Tundikeri in addressing tonsillitis. But unfortunately, I have not obtained much results just by referring the context or practices from the Tundikeri concept. Instead, I feel that we have to think about the concepts of apaji or the context of Gandamala in addressing conditions of recurrence, especially as a recurrent tonsillitis. And in such type of patients, fortunately, I have found very good results with combinations from the Kerala traditional textbooks like Arogya Raksha Kalpadrumam. If you refer the context of Abaji Gandamala, you will see a formulation there which is known as Varabrihatyadi Kashayam. Varabrihatyadi Kashayam is an excellent formulation which can be given in case of recurrent tonsillitis. Make sure about the avastha, swabhavam of the tonsillitis. Try to advise as much pathyam as possible in those cases. Combinations of Varabrihatyadi Kashayam, Punarnavasavam as well as Amrtarishtam along with Kanjanara Gugulu had helped me tremendously in majority of the cases in which surgery was advised. And I can still remember the smiling faces of many parents and children who came to me, thanking me so that they came out from the surgical table. So I feel that we have to check the Apachi Gandamala context rather than thinking about the concept of Shobham or Tundigeri and all. And Varabhratadi Kasham is found to be highly effective. Unfortunately, no company is manufacturing that. It is a very simple combination. If you have Arogya Raksha Kalpadrum, please refer the context of Apaji and Kantamala. And that is found to be highly effective.
Thank you, sir. Prevent for the respiratory diseases of children. Any particular prevention?
Sorry, madam.
Prevention for the respiratory diseases of children.
Prevention.
Prevention. Ah,
Uh, Prevention, the first and foremost thing is that the exposure to the respective elements should be addressed. The second thing is that giving Shuddha Chikitsa, then Lakshanika Chikitsa to prevent the Punaravartaka Swabhava. See, always keep in mind that, as I told previously, you cannot keep a child in your showcase. He is a person who's getting continuous exposure to the environment, continuous exposure to the Kalam, Desham, Vayu, Jalam, and all, isn't it? Charaka himself has told about the Dhanapado concept. So once the Vayu, Jalam, Desham, and Kalam gets polluted means, of course, that may end up in diseases even in a healthy person. So what happens in the case of a child? The child is known as a Bala. Bala means Balena Nyuna iti Balaha. The congenital nature of the child is the decrease in Balam. So in such cases, if a person who's having less Balam by his nature itself, not by the pathology, by his physiology itself, is getting exposed to an environment where there is a high incidence of having a disease means, of course, he will be having some sort of diseases. So starting from that spectrum, ending up in a condition where you are having a proper Swastha Vritta Bala Paricharya, giving sequential Krimihara Chikitsa every 6 months in a systematic manner, not just by advising the albendazole, nothing like that. You have to perform a systematic Chikitsa, advising them to have a proper Swastha Vritta Charya, including the Dinacharya and Ruducharyas, advising proper aharam. Matravata aharam is the most important vyadhi kshamatva vardhagopayam, as madam will be knowing that. Matravata aharam is the most important thing. Rather than going behind Swarna Prashanam or Vaja with Swarnam and all, Matravata aharam has been told. And what is this Matra? Matra Dravyanya Bekshande, and Matra is the method by which we can correct the Agni. Matra hi Agnehi Pravartaka. And beyond that, Agni Samrakshanam hi Chikitsa is the most important thing to prevent any sort of illnesses. So that is not just with respect to a pediatric perspective. We have to connect all these things. So that concept of aharam, proper Krimihara Chikitsa, having a proper ahara viharam, improving the quality of life. This is a cyclical method to improve the quality of health in pediatric cases. There is no shortcut for all those things.
sir. Yes, sir. Thank you. Conservative Ayurvedic management of deviated nasal septum related elements.
Unfortunately, I don't have an experience because I feel that the anatomical issues are, we used to say, Dhanvantariyana Madhikaraha, isn't it? Unfortunately, I am not a follower of Dhanvantariyana Madhikaraha. I come under the Vagbada perspective. So, and being a bony deformity, I don't have an experience of all these things. And I feel that from the Shalakitantra department or with my friends who are working in Shalakitantra department, I have seen many of them doing experiences, or they are telling about the clinical experiences regarding the application of Murivenna like percentage, Murivenna like formulations. They say that they advise Murivenna Varti in the inner part of the nose, and they slow abhyangam that is done. I don't have a authentic experience to share with you because I don't treat such patients. Whenever a patient comes to me with a DNS, I will try to console them first, because you will among the patients who are coming to your PD, more than 80% will be having an undiagnosed DNS. That is for sure. Especially in case of respiratory issues, if you examine the nose, you will be see the convexity towards one or the other side. So I'll console the patient first, because all of a sudden when you say you have a DNS means they'll be fainting off. Because they'll be hearing it for the first time. So consoling the patient is very much important. And beyond that, I'll be advising them to meet a Shalakitandra expert.
Sir, your experience on Avapidanasya.
I don't do Apidanasam in Shwasarogam because, see, I'm dealing with very small children. I don't have that experience.
Content tablet to chew on in CASA from experience.
Chewable tablet.
Uh,
I don't advise chewable tablet. I have some patent combinations. For example, Alarkhand tablet I used to advise for chewing. Dhanvantaram tablet I used to advise for chewing. Gorojanadi I used to advise for chewing. These are the three common drugs which I advised for chewing. But you see, I told you the Vishada Swabhavam of all these medicines is a challenge for us. the child will not be cooperative in chewing all these tablets because most of our drugs is not. That may be a fact because of the beauty of a science. See, we are dealing with a condition where the kabhadikam is more. Of course, we are not supposed to provide Madhura Swabhava Aushadams because the Madhura Swabhavam itself may aggravate the kapha, isn't it? So that may be the beauty of the blending which was made by our respected acharyas, age-old sages in addressing the cases because of Tikta Kashayarasam that may address the kapha Swabhava. So I don't feel there is a good choice for chewable tablet in Ayurvedam for a pediatric case with respect to respiratory issues.
Patya in Swastika, sir.
I just mentioned the Patya in detail while going through that. The Viharas I have already mentioned. Then coming to the Aharam, the current trends which we follow, the junk foods. See, we don't get a direct clue with the Kabha Vruddhikara Swabhavam of the Aharas connected with the Nidanam. But interestingly, this is indirectly causing a typical ajirnam inside the body, which may end up in a grave condition or which may end up in a condition which may lead to punaravartaka swabhavam. So even though you feel that much bulk of kapham in the respective aharam as that of a gridam or dadi or whatever it may be, or laddu or whatever it may be, still keep an eye about the chance of an ajirnam to happen. For example, in case of a, what I say, in the case of a fried item as that of a chips or a kurkure or whatever it may be, that may end up in ajirnam, which may aggravate a type of kasam, sometimes maybe in the spectrum of a vadiga kasam or vadapaitya kasam. So thinking about the patient as such rather than the disease is more important because we know we treat the patients and not the diseases. So all sort of methods that is mentioned in the context of Nidanam, Samprapti as Rasanam should be taken into consideration. Thinking about the perspective of the pediatric plane, this should be blended together to address the Pathyapathyam. Generally, I will advise the patient, I will talk to patient for at least 20 minutes. It takes 20 minutes for me to complete one patient. So generally 20 to 30 is the maximum number of patients which I see in the OPD. It takes much effort, but I feel that pays well. That pays well.
Thank you so much for sharing your wonderful clinical experience. I think the audience are so much enlightened, delighted by your experience and wonderful knowledge, sir. Thank you so much, sir. A short period of time, you agreed for our invitation and presented your clinical experience. Thank you. Thank you so much, sir.
Thank you, madam. It was just because of Shinas I came to know about the institution, and he's one of my favorite students. So I am happy that our students becoming teachers means it is an honor for us, isn't it, madam? You will be knowing that. So I'm so happy that he is there, and he is ready to hand over the torches which was carried over by us. Thank you so much, the institution. Thank you so much, the organizers. It was a pleasure to be here with you. Thank you so much. Expecting to meet you in later. Thank you so much.
Sure, sir. Same here, sir. Thank you so much. Thank you to our Prabodhini team for arranging such a wonderful session from Arun, sir. Same we are expecting in future, sir. Please be connect with us. Thank you so much, sir. Now we are coming at the end of the session. Before winding the session, we will do the Janagana Mana. Now I request our scientific committee to play the Janagana Mana.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you all for patience hearing. We will be allowing participant certificate to all the participants within a week. If any issues, please message in the WhatsApp group of Prabodhini. Thank you one and all. Thank you. Namaste to all.